Hello and welcome back to our Bitesized learning. Today we will be speaking about refeeding syndrome with one of the dietitians at Springfield Hospital, Cerri. Cerri, can you please introduce yourself?
Hello, my name's Cerri Williams. I'm one of the dietitians on the eating disorders wards, both Avalon and the day unit.
Thanks for joining us today, Cerri. First question, what is refeeding syndrome?
Refeeding syndrome occurs after a period of starvation or malnutrition when the person is becoming re-nourished with food. Because of the period of starvation, the body undergoes a series of metabolic changes. These changes increase the needs for electrolytes and B vitamins. These shifts in the needs of these electrolytes can result in complications such as cardiac, neurological and respiratory, and could potentially be fatal.
Typically, who does refeeding syndrome affect?
So refeeding syndrome can affect a wide range of service users. So those who are most at risk are those who have had little to no nutrition for more than 5 days. It can also affect those who have got a low BMI, so looking at an underweight BMI of 18.5 or less, and the lower the BMI, the more at risk the patient will be. It can also affect obese or overweight patients, and they may not seem like the likely candidate at first, but this is where it's really important to assess using a food or fluid chart to ascertain if they've gone for more than 5 days without any nutrition. Those also with a history of drug and alcohol abuse, those who abuse laxatives or diuretics, and those who've got a history of binging and purging. And last but not least, those patients who are using insulin.
What might you see if someone has refeeding syndrome?
So the first thing that you want to look for in someone who potentially is at risk of refeeding is their electrolytes, so potassium, phosphate and magnesium. These may not initially appear to be low prior to feeding, but once feeding commences, that's generally when you're going to see these electrolytes lower, okay? Also look for signs of edema or swelling in the ankles, feet and the face. Heart rate can increase, you can get palpitations, chest pain, respiratory distress, so shortness of breath as well as increase in heart rate and your blood pressure.
What are the symptoms and signs of refeeding syndrome?
So the symptoms and signs of refeeding are, again, like I aforementioned, you can get a drop in your electrolyte levels, so phosphate, magnesium, potassium. Also swelling, so edema in the ankles, face and hands, increased heart rate or changes in your blood glucose levels. Also things like, your blood pressure as well.
What do you think we should do to help someone who has refeeding syndrome?
So first and foremost, if you suspect a service user has refeeding syndrome, it is imperative that you refer to a dietitian. A dietitian is qualified to provide a specific meal plan that is designed for that patient's needs. If a dietitian is not available, there is a first line refeeding guidance which should be available at ward level. If you are looking to reintroduce food after a patient has undergone a period of starvation or malnutrition, they are at risk. What's really important is that energy intake is introduced really gradually into the diet, okay? Because it's quick intake of food which actually causes the refeeding syndrome. As well as that, we need to be making sure that we're monitoring the electrolytes, so potassium, phosphate and magnesium. And you should be asking a doctor to prescribe as well the B vitamins, so thiamine, 50 milligrams, and that's 4 times a day. Vitamin B co-strong, 1 to 2 tablets 3 times a day, and also a vitamin and a mineral supplement for 7 to 10 days. As well as that, we want to be looking at the vital signs and the blood glucose levels as well, and a weekly weight, okay? Using the weekly weight, we can also see if there's any signs of water retention in the body, but also to see if that patient is, again, gradually increasing their weight or they're continuing to lose weight.
Ah, I see. Sixth question, what are the risks of refeeding syndrome?
So there are many risk factors with refeeding syndrome. Like I aforementioned, it's respiratory, cardiac and neurological, okay? So there's a whole host of different issues that can result as a factor of refeeding syndrome. Potentially they can be fatal, they can lead to multi-system organ failure. So it is really important that refeeding syndrome is detected at the earliest convenience.
So, Cerri, what are the potential outcomes for someone who has refeeding syndrome?
So the outcomes of refeeding, so if a patient is treated appropriately, they're referred to a dietitian and the correct protocol is followed, there's no reason why a patient cannot make a full recovery from refeeding syndrome with no lasting impact, okay? However, on the opposing hand, if refeeding syndrome goes untreated, it can potentially be fatal.
Are there any protocols for this?
Yes, there is a first line refeeding policy that can be accessed. That can be accessed at ward level, or it can be accessed from the internet, or if you would like a copy, please contact the dietitian department.
Thank you so much for speaking with me today, Cerri. You've really helped me understand more about refeeding syndrome.